There are really only 3 areas in the state of Mississippi that anyone could remotely call urban. The rest of the state is rural. It's just that simple.
That's why programs like ours and the Center for Telehealth try to reach out to those people that live in areas that are more difficult to access care and provide those services they need.
RPM, or remote patient monitoring, allows us to extend care beyond the hospital walls.
Patients are enrolled by their provider. And so when the provider identifies the patient as a good candidate for the program, then optimally they would introduce and discuss the program with the patient. So after we determine that the patient is ready for enrollment, then we order the equipment to be shipped to the patient's home. Once the equipment is received, our support team then calls the patient to do an onboarding or installation call. If the nurse who's monitoring the patient notices anything that is troubling, like the blood pressure is too high or too low, then she'll initiate contact with the patient.
If it were just me or one other person trying to do this alone, we wouldn't be able to reach as many patients. And so that multidisciplinary team-based care model allows us to do that more effectively.
Telehealth can pose some hope for those patients who are living in those rural areas and who really have a desire to prevent complications, but also to manage those conditions as they already exist.